Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Efficacy and safety of Obinutuzumab in active lupus nephritis. Background. Obinutuzumab, a humanized type 2 anti-CD20 monoclonal antibody, provided significantly better renal responses than placebo in a phase 2 trial involving patients with lupus nephritis receiving standard therapy to occlusions. Among adults with active lupus nephritis, Obinutuzumab plus standard therapy was more efficacious than standard therapy alone in providing a complete renal response. The next article. Pulsed field or cryoballoon ablation for paroxysmal atrial fibrillation. Background. Pulmonary vein isolation is an effective treatment for paroxysmal atrial fibrillation. Pulsed field ablation, PFA, is a non-thermal ablation method with few adverse effects beyond the myocardium. Data are lacking on outcomes after PFA as compared with cryoballoon ablation as assessed with continuous rhythm monitoring occlusions. Among patients with symptomatic paroxysmal atrial fibrillation, PFA was non-inferior to cryoballoon ablation with respect to the incidence of a first recurrence of atrial tachyarrhythmia, as assessed by continuous rhythm monitoring. The next article. Fidanacogene Elaparvovec for Hemophilia B, a multi-year follow-up study. Background. Treatment with Fidanacogene Elaparvovec, a recombinant adeno-associated virus, AAV, vector developed for the treatment of hemophilia B, led to sustained expression of the high-activity factor IX variant, FixR338L, or FixPadua, in a phase 1/2a study. The long-term safety and efficacy of this treatment are not known. Conclusions. Fidanacogene Elaparvovec was associated with no or only low-grade adverse effects over a period of 3 to 6 years. Efficacy was maintained in the long term at 5 × 10^11 vg per kilogram, one of the lowest intravenous doses of OV used for any indication. Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Efficacy and safety of Obinutuzumab in active lupus nephritis. Background. Obinutuzumab, a humanized type 2 anti-CD20 monoclonal antibody, provided significantly better renal responses than placebo in a phase 2 trial involving patients with lupus nephritis receiving standard therapy to occlusions. Among adults with active lupus nephritis, Obinutuzumab plus standard therapy was more efficacious than standard therapy alone in providing a complete renal response. The next article. Pulsed field or cryoballoon ablation for paroxysmal atrial fibrillation. Background. Pulmonary vein isolation is an effective treatment for paroxysmal atrial fibrillation. Pulsed field ablation, PFA, is a non-thermal ablation method with few adverse effects beyond the myocardium. Data are lacking on outcomes after PFA as compared with cryoballoon ablation as assessed with continuous rhythm monitoring occlusions. Among patients with symptomatic paroxysmal atrial fibrillation, PFA was non-inferior to cryoballoon ablation with respect to the incidence of a first recurrence of atrial tachyarrhythmia, as assessed by continuous rhythm monitoring. The next article. Fidanacogene Elaparvovec for Hemophilia B, a multi-year follow-up study. Background. Treatment with Fidanacogene Elaparvovec, a recombinant adeno-associated virus, AAV, vector developed for the treatment of hemophilia B, led to sustained expression of the high-activity factor IX variant, FixR338L, or FixPadua, in a phase 1/2a study. The long-term safety and efficacy of this treatment are not known. Conclusions. Fidanacogene Elaparvovec was associated with no or only low-grade adverse effects over a period of 3 to 6 years. Efficacy was maintained in the long term at 5 × 10^11 vg per kilogram, one of the lowest intravenous doses of OV used for any indication. Next, we will be discussing articles from Journal of American Medical Association. Use of life support and outcomes among patients admitted to intensive care units. Question: how have intensive care unit, ICU, care and outcomes changed in the United States over the past decade? Findings: in this nationwide cohort of ICU admissions from 2014 to 2023, in-hospital mortality and ICU length of stay were stable throughout the 2010s, increased during the COVID-19 pandemic, then returned to pre-pandemic levels. In-hospital mortality was increased during the pandemic regardless of COVID status. Since 2014, vasopressor use increased threefold, while mechanical ventilation rates decreased, meaning following pandemic-era changes, many ICU outcome measures returned to prior levels. The rates of mechanical ventilation have declined even further, while vasopressor use remained significantly elevated above 2010's rates. Next, we will be discussing articles from Annals of Internal Medicine. Patterns of U.S. firearm injury emergency department visits, by month, day, and time, during 2018 to 2023. Background: monitoring temporal trends in firearm injury-related emergency department (ED) visits is challenging because traditional surveillance systems lack detailed temporal information. Objective: to describe temporal patterns of ED visits for firearm injury using data from the Centers for Disease Control and Prevention's CDC Firearm Injury Surveillance Through Emergency Rooms, FASTER program. Conclusion: distinct temporal patterns in firearm injury ED visits highlight resource allocation considerations for prevention and response efforts. Next, we will be discussing articles from British Medical Journal. Firearm availability and firearm incidence. Quasi-experimental analysis using start of U.S. hunting seasons. Objective: to take advantage of the arbitrarily timed increase in firearm and ammunition availability, brought on by the start of deer hunting seasons to study its impact on hunting, and importantly, non-hunting related firearm incidents. Design quasi-experimental analysis using start of hunting season in United States. Conclusions: the start of hunting season was associated with increased rates of hunting and non-hunting related firearm incidents, most plausibly because of the increased availability of firearms and ammunition. The results suggest that efforts to promote firearm safety at the beginning of hunting season could help reduce hunting and non-hunting related firearm incidents. Next, we will be discussing articles from Lancet. Effective invitation to colonoscopy versus fecal immunochemical test screening on colorectal cancer mortality, COLONPREV, a pragmatic, randomised, controlled, non-inferiority trial. Background: colonoscopy and the fecal immunochemical test are accepted strategies for colorectal cancer screening in the average risk population, people aged greater than or equal to 50 years without personal or family history of colorectal cancer. In this trial, we aimed to compare whether invitation to screening with fecal immunochemical test was non-inferior to colonoscopy in a screening program. Interpretation: participation in screening was higher among individuals invited to fecal immunochemical test screening than colonoscopy screening. On the basis of participation observed in this study, a fecal immunochemical test-based program was non-inferior to a colonoscopy-based program for colorectal cancer-related mortality. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Trastuzumab pertuzumab plus eribulin or taxane as first-line chemotherapy for human epidermal growth factor 2, positive locally advanced/metastatic breast cancer. Purpose: trastuzumab pertuzumab, HP, plus taxane, is a current standard first-line therapy for recurrent or metastatic human epidermal growth factor 2, HER2 plus breast cancer, BC. We investigated non-inferiority of eribulin to a taxane when combined with dual HER2 blockade as first-line systemic treatment for locally advanced/metastatic HER2 plus BC. Conclusion: The results suggested that eribulin plus HP is an option for first-line treatment of locally advanced/metastatic HER2 plus BC. Here are the articles from Journal of Hepatology NPLA3 RS738409, Environmental Factors and Liver-Related Mortality in the U.S. Population. NPLA3 RS738409 and obesity are major drivers of liver-related mortality. Light alcohol intake, smoking, and high levels of cholesterol in the diet positively contribute to liver-related mortality. Healthy eating patterns and a high consumption of monounsaturated fat are associated with reduced risk of liver-related mortality. 3 or more cups of coffee per day are linked to a reduced risk of liver-related mortality. Lifestyle and environmental factors can exacerbate or attenuate the inherited risk of liver disease and mortality due to NPLA3 RS738409. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. ERBB2 Comprehensive Profiling and Prognostication in Stage 3 Colon Cancer. Findings from PATAC-8 and IDEA France cohorts. Background and aims. ERBB2 pathway activation, through amplification or activating mutations, represents a new target for colon cancer (CC) treatment. Molecular methods were compared with the gold standard for assessing ERBB2 status, and the prognostic value of ERBB2 amplification, mutations, and expression was determined using data from 2 phase 3 trials involving nearly 3,000 patients with stage 3 CCC. Conclusions. The molecular definition of ERBB2 status could represent a cost-effective alternative in stage 3 CC. ERBB2 alterations and low RNA expression significantly reduced TTR, highlighting the complex role of ERBB2. Here are the articles from Clinical Gastroenterology. Histological outcomes of pharmacological interventions in eosinophilic esophagitis for adults and children, a network meta-analysis of randomized controlled trials. Introduction. Multiple pharmacological interventions have been studied for managing eosinophilic esophagitis, O. We performed a comprehensive systematic review and network meta-analysis of all available randomized controlled trials, RCT, to assess the efficacy and safety of these interventions in O in adults and children. Conclusions. Network meta-analysis demonstrates histological efficacy of multiple medications for O. Because of the heterogeneity and large effect size, we recommend more trials comparing pharmacotherapeutic interventions with each other and placebo. An important limitation of this study is absence of clinical efficacy data due to insufficient data. Other limitations include heterogeneity of operator, population, and outcome analysis. Next, we will be discussing articles in the field of rheumatology. Osteoclastogenesis in patients with systemic sclerosis with and without calcinosis cutis. Objective. We aimed to assess whether the presence of radiographically confirmed calcinosis of the hands in patients with systemic sclerosis, SSC, is associated with increased osteoclastogenesis. Conclusion. Calcinosis in patients with SSC is associated with an increased propensity of peripheral blood cells to form osteoclasts. Targeted inhibition of osteoclastogenesis may provide a specific therapeutic option for patients with SSC-associated calcinosis. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Childhood Familial Mediterranean Fever in the United States. Spectrum of clinical phenotypes and MAFIF genotypes in a cohort from Southeast Michigan. Objectives. The aim of this study was to report the spectrum of familial Mediterranean fever, FMF, in children living in Southeast Michigan. Conclusions. We report the largest childhood FMF cohort in the United States. A negative family history should not preclude consideration of FMF as a cause of periodic fever. Recurrent fever can be the only manifestation, particularly in young patients with FMF. The absence of fever and chronic progressive musculoskeletal manifestations can uncommonly occur. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Differential associations of cigar, pipe, and smokeless tobacco use versus combustible cigarette use, with subclinical markers of inflammation, thrombosis, and atherosclerosis. The Cross-Cohort Collaboration Tobacco Working Group. Background. Understanding the associations of tobacco product use with subclinical markers is essential in evaluating health effects to inform regulatory policy. This is particularly relevant for non-cigarette products, e.g., cigars, pipes, and smokeless tobacco, which have been understudied because of their low prevalence in individual cohorts. Conclusions. Use of non-cigarette tobacco products is linked to subclinical markers related to cardiovascular harm. Inflammatory markers, such as high sensitivity, C-reactive protein, and interleukin-6, have the potential for assessing early cardiovascular harm from using these products and aiding regulatory authorities in evaluating their associated risks. Here are the articles from Journals of the American College of Cardiology. Genetic risk and first trimester cardiovascular health predict. Hypertensive disorders of pregnancy in nulliparous women. Background. Hypertensive disorders of pregnancy, HDPs, preeclampsia/eclampsia, and gestational hypertension, are a leading cause of maternal and perinatal morbidity and mortality, and are associated with long-term maternal cardiovascular disease. High genetic risk and poor cardiovascular health, CVH, are each associated with HDPs, but whether genetic risk for HDP is modified by CVH status in early pregnancy is unknown. Objectives. In this study, the authors sought to test the independent and joint associations of genetic risk and first trimester CVH with development of HDP. Conclusions. Lower genetic risk and higher first trimester CVH were independently and additively associated with lower risk of developing HDPs in nulliparous individuals. Favorable CVH in early pregnancy may mitigate high genetic risk for HDP. From JAMA Cardiology. Treatment strategies to control blood pressure in people with hypertension in Tanzania and Lesotho, randomized clinical trial. Question. Is a 2-pill antihypertensive strategy non-inferior, and is a low-dose 3-pill strategy superior to starting full-dose monotherapy with stepped escalation in controlling blood pressure in people with hypertension in rural Tanzania and Lesotho? Findings. In this 3-arm randomized clinical trial including 1,268 individuals, starting 2 pills was non-inferior, and starting 3 pills was not superior compared with stepped monotherapy for blood pressure control at 12 weeks. Meaning results show that the 3 strategies led to similar blood pressure control. Wide Cs preclude the ability to rule out clinically important effects of the additional pill strategies for hypertension control. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Efficacy and safety of TransCon PTH in adults with hypoparathyroidism, 52-week results from the Phase 3 Pathway trial. Context. Conventional therapy for hypoparathyroidism aims to alleviate symptoms of hypocalcemia, but does not address insufficient parathyroid hormone, PTH, levels. Objective. Assess the long-term efficacy and safety of TransCon PTH, paliperidone, for hypoparathyroidism. Conclusion. At week 52 of the Pathway trial, TransCon PTH showed sustained efficacy, safety, and tolerability in adults with hypoparathyroidism. Here are the articles from Diabetes Care. Longitudinal associations of FOS exposure with insulin sensitivity and beta cell function among Hispanic women with a history of gestational diabetes mellitus. Objective. We investigated associations between PER and polyfluoroalkyl substances, PFAS, and changes in diabetes indicators from pregnancy to 12 years after delivery, among women with a history of gestational diabetes mellitus, GDM. Conclusions. FOS exposure is associated with glucose intolerance, insulin resistance, and beta cell dysfunction, thus increasing type 2 diabetes risk. Next, we will be discussing articles in the field of neurology. Here are the articles from neurology. Investigating whether dissemination in time is essential to diagnose relapsing multiple sclerosis. Background and objectives. The diagnosis of multiple sclerosis, MS, requires evidence of both dissemination in space, DIS, and time, DIT. Oligoclonal bands, OCBs in the CSF can substitute for DIT on MRI. We investigated whether DIT, or positive CSF, is necessary to make a diagnosis of MS in patients who fulfill a high number of DS criteria. Discussion. In patients with a first demyelinating event, DS in greater than or equal to 4 regions typically affected in MS is highly specific, indicating an extremely low risk of false positive results and misdiagnosis. Using DIS in greater than or equal to 4 regions would reduce the need for follow-up MRI or CSF examination in all patients with suspected MS, streamlining the diagnostic process. Limitations include an overrepresentation of patients with optic neuritis at onset, a low rate of CSF examination, and lack of optical coherence tomography data. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. Sarcoidosis treatment patterns in the United States. Background. There are limited U.S. Food and Drug Administration approved medications and real-world data on sarcoidosis treatment in the United States. Concordance of practice patterns with guideline recommendations have not been well characterized. Research question. What are the practice patterns and factors associated with treatment for patients with sarcoidosis in the year following diagnosis? Interpretation. Within the first year of diagnosis, 43% of patients with sarcoidosis were started on treatment. Non-steroidal immunosuppressives were used in 40% of treated patients. Although factors associated with treatment initiation aligned with guideline recommendations, practice patterns of treatment were variable, particularly in choice and sequence of non-steroidal immunosuppressive therapy, underscoring the need for future trials and comparative effectiveness study. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Nasal high flow to modulate dyspnea in orally intubated patients. Rationale. High flow therapy reduces dyspnea in acute respiratory failure, but the underlying mechanisms are not fully elucidated. Objectives. To compare dyspnea, we measured airway occlusion pressure, P0.1, and inspiratory work with and without nasal high flow, NHF, VO2, 21%, temperature, 31 degrees Celsius, in intubated patients under pressure support ventilation, and during a spontaneous breathing trial, SBT. Conclusions. In orally intubated patients, NHF was associated with lower dyspnea and lower respiratory drive without affecting the inspiratory work. Next, we will be discussing articles in the field of nephrology. Here are the articles from Kidney International Reports. Randomized trial of lower-dose roxadustat efficacy and safety in non-dialysis-dependent CKD-associated anemia. Introduction. Different starting doses of roxadustat are used for treating anemia in chronic kidney disease, CKD. We tested the non-inferiority of weight-based lower starting dose compared with standard starting dose roxadustat for anemia in stage 3 to 5 CKD without dialysis. Conclusion. The proportion of patients who achieved the hemoglobin target was comparable between the doses. The lower starting dose had less hemoglobin fluctuation and is recommended for stage 3 to 4 CKD. Open label, randomized, controlled, crossover trial on the effect of dapagliflozin in patients with ADPA-TD receiving tolvaptan. Introduction. Although dapagliflozin, a sodium glucose cotransporter 2, SGLT2, inhibitor, delays the progression of chronic kidney disease, CKD, its effect on patients with autosomal dominant polycystic kidney disease, ADPT, has not been established. We conducted an open-label, randomized controlled crossover trial to evaluate the additive effects of dapagliflozin in patients with ADPT receiving tolvaptan. Conclusion. In patients with ADPCT treated with tolvaptan, dapagliflozin may have an additive effect in slowing ADPC progression.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.